안녕하십니까.
Hello, I'm a director of Master Course, Basic Course, and I'm Dr. Kim Jin, Oromaxillofacial Surgeon at the Catholic University Daejeon St. Mary's Hospital. Do you realize that implant patients are increasing quite a lot? I am with the university, so we have a lot of referred patients, but we are seeing increasing number of old senior patients who want implant treatment under national health insurance. When I talk to other dentists, seniors or junior dentists or colleagues, I hear that we have many senior patients who want insurance implant treatment with the aging society. So if you encounter a patient, an old patient who want implant treatment, what are you going to do? For example, a patient is 80 years of age and the patient is using a stick when walking or on a wheelchair and with a hearing aid accompanied by a carer, and the patient told the receptionist he wants an implant treatment to be covered by the national insurance. His medical history shows hypertension and uncontrolled diabetes, and he also received heart stent surgery before. Lately, he has kidney dysfunction, so dialysis is being done. How are you going to treat him when such patient comes to you for implant treatment? Today, let's have a look at systemic diseases and medications. Systemic diseases, there are a variety of them. Today, we are going to look at cardiovascular diseases, neurology, endocrinology, gastroenterology, and nephrology, followed by medications. First, systemic diseases. Let's have a look at cardiovascular diseases. The doctors, me and you, are dentists. We are not internists, so we don't have to control or prescribe medications for systemic diseases. However, we need to be able to deal with patients who come to us for dental treatment with systemic diseases. With an aging society, cardiovascular diseases are prevalent. So let's have a look at the representative disease of hypertension. As I said before, hypertension patients do not need to be treated by a dentist. When a patient comes to a dental office for dental treatment, we just need to provide an appropriate treatment considering the hypertension, which is good for us. Let's look at patients with hypertension. Common symptoms of hypertension include dizziness, and most commonly when walking, you can feel irregular heartbeats or tight chest, nausea, or vomiting. Hypertension, what is it? First, what is blood pressure? It is the pressure of blood flowing in a vessel, but simply we just need to remember the numbers 120 and 80. This is the standard numbers, normal range. I'm at a university. I'm not working in a dental university, but in a medical college. So we don't call it cardiovascular internal medicine. We just call it cardio internal medicine, and that means cardio internal medicine doctors view this standard more strictly. They used to accept a little bit over 120 and 80 when the patient is old. However, cardio internal medicine doctors strictly adhere to this standard of 120 and 80. Then, what do we need to check in a dental clinic? Patients with hypertension, if they are under control, with medications, there's no problem. You could treat them as normal patients. However, there are some matters we need to check when such patients come to a dental office. Hypertension is very sensitive to stress, so we need to minimize stress for such patients. Unlike in the past, prophylactic administration of hypertensive medications includes aspirin administration so that blood flows smoothly in the vessel, not to erupt the vessels. So baby aspirin is routinely prescribed for hypertensives. For hypertensives, we need to minimize the stress to the patients. Therefore, dentist appointments needs to be arranged for the morning. If possible, if a patient is taking medication and hypertension is under control, you can treat the patient as a routine patient. Ask a patient if he or she is on aspirin, and then we need to consider the possibility of bleeding due to aspirin in the case of a hypertensive. Also, along with various devices in your dental clinic, you need to make sure that you need to be equipped with at least one automatic blood pressure gauge. So before treatment, you need to check the blood pressure while the patient is on medication. What is very important during consultation is the lidocaine that we routinely use. Epinephrine is included in lidocaine, which is a vasoconstrictor. So it contributes to hemostasis, but it can cause high heartbeats or chest tightening in the patients. I said that epinephrine is a vasoconstrictor. In the case of bleeding during treatment, if the patient is healthy, applying compression is the best, but 1 to 10 or 1 to 8 lidocaine in an ampoule can be applied for hemostasis. That's another tip. So what is important in treating hypertensive patients is that we need to reduce stress during treatment. We need to make the patient seated and take blood pressure. And during treatment, we need to pay attention to the lidocaine injection. Slow injection is the best way to prevent problems. We know that lidocaine ampoules should be kept at body temperature as much as possible for painless care, and we also need to use very thin needles. Most importantly, we need to observe how the patient reacts while doing very slow injection. We need to watch for chest tightening, or you have to be careful because patient face may become pale, and if a patient has cardiovascular problems, we need to think about using less than 3 ampoules of lidocaine. We tend to use quite a lot without knowing it, and if a patient has hypertension which is not controlled with medication, it is essential to consult with an internal medicine by all means. Following hypertension, hyperlipidemia is a next problem. In other words, cholesterol blocks blood vessels, preventing the supply of blood flow. So here, this can lead to a complete blockage inside the vessels as it is now here. That's the problem with ischemic heart disease. So let me reiterate. Hyperlipidemia patients have prescribed medications that keep cholesterol from blocking vessels. That is, when a patient with hyperlipidemia comes, the medicine that this person is taking can cause bleeding, and you should approach it knowing about it. As part of this, ischemic heart disease is divided into angina pectoris and myocardial infarction. This ischemic heart disease is caused by a lack of blood flow to surrounding areas. Angina causes necrosis around the cardiovascular system due to cholesterol blocking blood vessels because of hyperlipidemia. It is a common factor as myocardial infarction. In terms of blood vessels completely blocked and become necrosis. So, what precautions should we exercise for these patients? When performing any dental care, there is a risk of bleeding, and we always need to try to minimize stress. So, the first thing we have to remember is while providing treatment, there can be a lot of bleeding. In that respect, it's the same as hypertension. When injecting lidocaine, we need to be careful because it contains epinephrine. Use epinephrine-free lidocaine or slow injection. You need to use less than 3 ampoules. Angina patients carry something with them for an emergency. Nitroglycerin to use in case of chest tightness and discomfort. You need to give less stress to the patients and tell them to bring it for an emergency. It's important to keep that in mind that patients with angina pectoris or myocardial infarction, that is, ischemic heart disease. Recently, neurology and other departments also reported death cases when aspirin was discontinued for cardiovascular problems. Since then, internal medicine became very strict and does not stop medications as much as possible. We hear from our patients that they stop taking medications to do a comprehensive physical exam using endoscopy. In internal medicine textbooks, it is recommended that 1 or 2 teeth can be extracted without medication discontinuation. So you need to treat them without stopping their medications. But the problem is your receptionists tell your patients to stop taking aspirin for 1 week prior to the next appointment. So if you have ever told your patients to stop taking aspirin, from today, I want you to think about it again. Please keep in mind that we are dentists and we are not prescribing medications for internal diseases. We are not internal medicine doctors. To neurology, we talked about cardiovascular diseases. Now we are talking about neurology, including brain, cerebral vascular disease, cerebral infarction, cerebral hemorrhage. Ultimately, whether it is by cerebral infarction or hemorrhage, what we need to think about is how to treat these patients. This is the same as I said before. If there is cardiovascular disease in a patient, we need to reduce the stress to the patients. If it is a simple treatment, it's okay. But if you are treating more than scaling, including surgical procedures or periodontal treatment, you need to think about the bleeding, and the patient would be on medications, so you need to be careful when we give anesthesia. You need to refer the patients to internal medicine doctors for medications. Many cerebral hemorrhage or cerebral infarction patients are on both aspirin and coumarin. So most likely they are on such medications and they also have cerebral vascular problems as well. Many of them visit cardio internal medicine departments. You need to consider the risk of bleeding when you treat such patients. Next, one of the most common modern diseases is diabetes mellitus in endocrinology. Regarding diabetes, basically, we need to remember 3 P's of diabetes: polyuria, polyphasia, polydipsia. Here in the middle, for dental treatment, what is the biggest problem with the diabetic? Slow healing and increased infection rate. You need to keep in mind that there is a high chance of infection when you treat diabetic patient for surgical treatment. Let's have a look at more accurate numbers. HbA1c. It's not something we can identify in a dental office. If you work in a big dental hospital where blood work is being done, HbA1c can be identified, but usually we don't see them. But we often see blood sugar is tested in a dental office. So I recommend you have a blood sugar and blood pressure gauges in your office. And we need to know the standard numbers. As we do not test the blood sugar level, we don't know the HbA1c. We just need to know routinely if it is less than 100, it is normal. If it is over 100, there's a problem. And if blood sugar is under control, there's no problem in treating the patient. If a patient says he has blood sugar testing regularly done and on diabetic medications, you just need to know whether the blood sugar is under control. I believe high blood sugar level doesn't pose a serious problem for dental treatment. Actually, hypoglycemia is the problem. If blood sugar level is high, it causes slow healing and increased infection rate, but it is chronic, not happening immediately, but hypoglycemia make a patient fall or have cold sweat immediately with dizziness, and that can happen in a dental office, and you need to arrange the visit of a diabetic patient after a meal, and I recommend you to have a blood sugar testing done in the office. And lastly, prophylactic administration of antibiotics, as diabetics have a higher infection rate. Other than that, you can consult with internal medicine. Next, there's an increase of osteoporosis patients. Bone density is low in this patient, and the bone structure is not dense, leading to frequent bone fracture. And they do bone density test. Regarding the numbers, we need to know these numbers just for reference because we don't need to treat them. Basically, if you look at the process of bone formation, bone is alive and it is regenerated. For regeneration, osteoclasts should be activated first. In osteoporosis patients, osteoclasts keep increasing, but bone is not formed. There are two types of drugs. Bisphosphonate is used to reduce osteoclasts. On the other hand, we can activate the regeneration of bone with vitamin D or calcium. Bronze is discussed for patients with osteoporosis. We can see the increase of that. Old-aged women in the 70s or over experience bronze. It is also called Marons because it is medication related. So you need to ask a patient if the patient is on osteoporosis medications. For old women, one more tip: recently, cancer patients, especially breast cancer patients, are on bisphosphonate for cancer treatment. So you need to ask them whether they are using the drug. They don't know the drug name. They just say they are on medications after cancer surgery. Next, liver disease in gastroenterology. Liver is involved in detoxification. it would be good if you can detect the problem immediately if jaundice patients is so obvious. But in many cases, the liver problem is not obvious, and the patient would say the liver function is not very good, so they are on medications. You need to remember two things. The liver medications can be detoxified in the liver and they have a bleeding tendency. Scaling alone can cause bleeding in dental treatment. The most prevalent liver problem among Koreans is type B hepatitis. So, if a patient has a liver problem, and you need to think about how to protect yourselves to prevent any problems in the patient with liver disease. Safe medications rather than NSAID, acetaminophen, penicillin cepha for antibiotics, and acetaminophen for analgesics. Simply put, Tylenol. Next, kidney disease, which is increasing recently. The kidney is not healthy. The patient would feel pain if you tap on their back. The patients may be on dialysis, and you need to avoid the period of dialysis when you provide dental treatment. To facilitate the blood circulation, they are on heparin, aspirin. So if you treat the patient on the day of dialysis, you can cause bleeding. Therefore, you need to avoid the day. Transplant patients are on Sandimun, which causes gingival proliferation. So if you notice thick gingival enlargement, you need to ask the patient if the patient received a transplant. What is important for these patients is the same. Dialysis patients, we need to provide dental treatment other than the day of dialysis, otherwise bleeding can occur. Kidney and liver have detoxification function for drugs. NSAIDs are not recommended as pain relievers for patients with problems in kidney. Just like liver patients, these patients are recommended to take acetaminophen. And Tylenol is the most common drug in the acetaminophen. Now, let's have a look at medication administration. We talked about systemic disease patients. We are dentists, and we talked about how to deal with the patients with systemic diseases. As I said before, they came to us to get implanted treatment. They are not here to get a systemic treatment. We can refer the patients to internal medicine for systemic treatment. There are drugs that we can use. Most of the drugs that we use are, in general, B and C according to FDA classification out of A, B, C, D, and X. There are some over-the-counter medications, even though they are specialized medications that we use. They are designated as over-the-counter drugs because of safety. There is no problem in using them without doctor's prescriptions. Conversely, we can think about the dosage and duration of the drug in terms of their impact on the whole body. Most frequently, we use antibiotics, anti-inflammatory, and painkillers, and the gastrointestinal protection agents, and rarely muscle relaxants, and the neurontin for paresthesia. They can occur after implant placement. So these are primarily the ones we use, even though recently Botox injection is also used. To sum up, we generally use antibiotics, anti-inflammatory agents, painkillers, and the GI protection agents. We don't really have to worry about the side effects of drugs that we use, except lidocaine. You can include a package of drugs in your treatment plan for simple extractions or implant placement, or to prevent infection. One penicillin, one acetaminophen, and one GI protection agent. I'm talking about Tylenol here. Next, if a problem is more serious, we can use cephalopenicillin and GI protection agent, acetaminophen. Painkillers, here Tylenol is used. I talked about liver and the kidney for systemic disease. This acetaminophen is not really recommended. For drug prescription, NSAID is not to be used, but acetaminophen is not a problem. The representative acetaminophen over-the-counter drug for anti-fever and analgesic is Tylenol. Among Tylenol, we have ER tablets. The ER tablets were once stopped selling in Europe, and they need to be melted over 8 hours, and the effect doesn't come out immediately for painful patient. So patients took the drug more than necessary, and that became a problem, leading to the stoppage of the sale. The drugs that we use, looking at the dosage and the period of use, there's no problem. So if you use over-the-counter drugs, you do not need to be worried about the drugs. So in conclusion, if a patient has systemic diseases and dysfunction in liver or kidney, the patient can receive Tylenol for pain. So within the constraint of time, we talked about the systemic disease. Patients who have them visit a dental office. Whether we provide implant or non-implanted treatment, we need to look at their systemic condition to provide proper dental treatment. This is a society of aging, so many older people present themselves with systemic disease, and they are on various medications. For more in-depth and detailed explanation regarding systemic disease, you can study using basic master courses. Thank you very much for your attention.